Welcome back. What is one of the most common reasons we go to the doctor or we miss work? It's back pain. And if you suffer from it because of degenerative disc disease, you will want to hear some exciting new news from our next guest. Spine Team Texas is one of only 40 centers in this country that's investigating a new potential treatment for the disease. And Dr. Ryan Reeves is here to tell us all about it. It's called the Cascade study. Good to see you.
Good to see you, Carrie.
So for those who don't know, what causes degenerative disc disease?
Well, degenerative disc disease is actually a breakdown in the cartilaginous or soft tissue structures between the bones in the low back. Over time, the cells can actually break down. That breakdown causes loss of space, and actually that can cause fissures or tears, which can lead to progressive pain and dysfunction over time.
It sounds painful. How is it typically treated?
Well, typical treatment options are rather limited to conservative care with physical therapy, medication, sometimes injections, well, if it advances, sometimes surgery.
So tell us about this Cascade study. What does it involve?
Well, the Cascade trial is a phase 3 trial that's looking at an exciting new investigational option using stem cells or mesenchymal precursor cells. These cells are cultured from healthy human adult donor marrow and are then actually grown out in the lab under very strict conditions. The trial will be recruiting 330 patients and will last approximately 1 year, with some participants being asked to follow up for a total of 3 years.
Okay, so up to 3 years it will last. So what can a qualified participant of the study expect to happen if they become a study candidate?
Well, the trial is broken down into actual 3 phases. The first phase is the actual enrollment. The first phase is actually the screening phase to evaluate whether or not a patient can be enrolled. The second phase is the treatment phase. During the treatment phase, one of 3 possible injections will occur. Injection with stem cells with something called hyaluronic acid, or injection of a saline or a placebo.
Okay, so what kind of patients may qualify for the Cascade study?
The patients that qualify are 18 years of age. They have low back pain due to a diagnosis of degenerative disc disease. The process has occurred for three months and failed conservative care, while patients don't need insurance to qualify because all the costs are covered.
Do they have to have health insurance in order to qualify for the study? So that's important to know. Why is the Cascade study important in comparison to, more the traditional degenerative disc disease treatments?
Well, the traditional treatment options, again, focus on conservative care, which often is ineffective and only focuses on treating the actual symptoms. This potential treatment option actually focuses on the potential problem of the actual disease process itself.
Okay. So, go ahead.
So over time, it'll allow us understanding how the drug works and may offer a potential option for people with the condition in the future.
As we mentioned, a lot of people out there suffer from back pain. So if our viewers are out there, they think they might qualify for something like this, what do they need to do?
Well, they can contact us. We have a study coordinator who's actually would love to start a phone interview to see if you qualify.
Easy as that. On the way to recovery. It's good news. Thank you.
You're welcome.
Good to see you. All right, if you suffer from lower back pain associated with degenerative disc disease and you are interested to see if you qualify to participate in this really great study, you can call the number on your screen. It's 888-512-3892, and you can also go to SpineTeamTexas.com. Spine Team Texas, by the way, has 6 locations throughout the DFW area.